evening. Fáile Pádraig Honadíobh. This is a St. Patrick's Day like no other, a day that none of us will ever forget. Today's children will tell their own children and grandchildren about the national holiday in 2020 that had no parties, no parades, but instead saw everyone staying at home to protect each other. In years to come, let them say of us, when things were at their worst, we were at our best. Our country is making big demands of our healthcare staff and big demands of every single one of us. Tonight I want you to know why these actions are being taken and what more needs to be done. We're in the middle of a global and national emergency, a pandemic, the likes of which none of us has seen before. So far, the number of cases in Ireland has been relatively small. However, we believe the number will rise to 15,000 cases or more by the end of the month and rise further in the weeks thereafter. The vast majority of us who contract COVID-19 will experience only a mild illness, but many will be hospitalised, and sadly some people will die. We cannot stop the virus, but working together, we can slow it in its tracks and push it back. We can, as you've heard by now, flatten the curve, but only if everyone takes sustained action. Nothing less will do. We all need to take steps to reduce close human contact. That's how the virus is spread. Not just at public gatherings or in public places, but also in our own homes, places of leisure, and places of work. Large public gatherings are cancelled. All pubs and bars are shut. And we've asked people to curtail or cancel social gatherings like parties, weddings, and other celebrations. I know these choices won't be easy, but they are necessary. And more will be required in the coming weeks to reduce the spread of the virus. At all times, we will be guided and take the expert advice from our public health emergency team, led by the Chief Medical Officer. We will always put your life and your health ahead of any other concern. All resources that we have, financial and human, are being deployed to serve this great national effort. We're watching what's happening around the world, and we will learn from the experience of other countries affected by COVID-19 before we were, what works and what doesn't. We know the best strategies focus on testing and contact tracing and social distancing, so that's our strategy. We will keep our essential services, supply chains and utilities operating. Many of you want to know when this will be over. The truth is, we just don't know yet. This emergency is likely to go on well beyond March 29th. It could go on for months into the summer, so we need to be sensible in the approaches we take.